Well, welcome back to PHI and PPE, a Copper Penny Consulting podcast. I'm Amy Wood, and I'm here with my amazing cohort here, Deanna Ott-Switfield. And we are just being adorkable on this rainy, rainy day. So,
Very
what's on your
true, very
mind
true.
today?
Well, we talk a lot about dirty things, but I want to talk today about what to do with old instruments and even old equipment that you have in your office, something that you're not using anymore. What are you supposed to do with it? Can you throw it in the trash? I mean, is it worth anything to salvage? So maybe we can shed a little bit of light on that.
Yeah, I mean, in both of our worlds, there's equipment that we have to think about,
Ooh,
right?
yeah. What kind of stuff are you wanting to talk about today?
I want to talk about cyber insurance because I'm starting to see some unique changes. I think that's the word I want to use today. Unique. Interesting is
Okay.
not really the right word. Interesting implies that it's good or bad, and
Mm-hmm.
it's different.
Okay.
Yeah.
Okay. So do dental practices have to have cyber insurance?
They should. So this is something I've been talking to practices about for over a decade at this
Okay.
point. And when I first started doing this, cyber insurance was brand new to the market. Nobody
Mm.
was doing it, nobody was adopting it. And those that were, it was really easy to get
Yeah.
because the questions were very simple, like, do you have antivirus and do you have backups?
Oh.
And that was it. And now that we've had so many claims, because of cyber incidents, because of data breaches, because of
Mm.
ransomware, a lot of these insurance carriers are starting to tighten things up.
Mm.
So now we're seeing questionnaires that are very long, several pages full of questions, and they're either very vague or they're hyper specific questions.
Okay.
And one that's kind of making me very concerned is, are all things encrypted in your office? Which,
Well,
I mean, you would assume, yes, they should be, right?
right.
Because some things are encrypted, but wouldn't all of them be? And the IT
Sure.
provider says you have encryption.
Right.
And so it's a
And
very misleading question.
and then what if offices don't know what all things are? What if they
Huh?
forget about a piece of equipment?
Exactly. Or it can't be encrypted.
Or it can't be encrypted. Yeah. Define things. Wow.
Right, define
Oh my
things. So,
gosh.
what I've been telling people to do is work with, HIPAA consultants and IT providers together and come up with a additional document that goes with that question that says, here are all the things that are in place for security and compliance and safety, and here's what's encrypted and here's what's not encrypted and why we made that choice.
That's pretty smart. That's pretty
Well,
okay. I wouldn't, yeah, if I had to fill out some sort of insurance information, I wouldn't even know where to start.
right. Well, and it's just one of those, it's kind of like the DIY manuals that we see for compliance.
Hmm.
They have very large questions, but an itty bitty little box to put it in.
Right, right. And then you're expected to share all this information so it's covered in
Right.
these compliance manuals, and you don't even have enough space to add that information in.
There's not enough space to even write the word compliance in it, let alone all the other things.
Wonder who creates these DIY manuals, these
Hmm. I
blanks.
mean, they all start from templates.
Yeah,
Everything, even our stuff starts with templates and
true,
goes from there. So,
true.
yeah, that's my take on cyber insurance. Everybody should have it, based on the number of active and inactive charts that you have.
Okay.
Should determine how much coverage you need and what your security posture is, what you have, what you don't have in place. That will dictate whether you can obtain it or continue to receive it. So that's why they ask all these questions now. They want you to increase your security
I
over time.
see. What kind of coverage are we talking about? Like a couple 100,000,
I've
a
seen,
million? Like what do
yeah,
dental practices need to think about?
I would say if it's a general practice, average size, single doctor practice, half a
Hmm.
million in coverage is more than reasonable and appropriate.
Okay,
I also think that if you're a specialist and you have a lot of one-time patients, a million in coverage is the minimum you should have.
I
If you have
see.
multiple doctors, multiple locations, that number goes up and up and up.
Right,
And it's
right.
not that expensive to have.
Well, that I was going to ask. So, cybersecurity insurance obviously is going to cover those cybersecurity incidents that may happen. But, will the Health and Human Service will they take into effect also like part of that safe harbor rule? Like if
Absolutely.
like you're making an effort to insure your business, but something still happened.
Yeah, it's considered an accident, not negligence.
Okay.
So that means the claim will be a lot less
Hmm.
because you have a higher probability of not having to report at all, not having to deal with any of the mitigation costs, which jack up the cost of an insurance claim. You won't
Hmm.
have to deal with high-priced attorneys that are specialists in data breaches and HIPAA. You won't have to have, notification letters sent out, which, that adds up very quickly when you think of just postage and paper and toner to print it.
Wow. Right, right.
So, I mean, there's just a lot of things that happen pretty quickly,
Hmm.
and those prices can skyrocket. But if you have a lot of safeguards in place, it kind of contains what the overall incident is and how much it will cost. So,
Right.
insurance companies, it's kind of like the bad driver discount or the good
Oh,
driver
the good
discount.
driver. Yeah, yeah, yeah. Oh,
Yeah.
that's a good way of interpreting it.
Yeah, it's like when you have a brand new teenager, they're gonna be awful, and so they're gonna charge more for new teenage drivers on your policy,
Right.
which I'm now dealing with. But if you've got seasoned people that haven't had tickets in 20, 30 years, then they're like, "Oh, you're a good driver, and we're gonna give you a discount for that."
Yeah. So, okay, I just want to bring this up. I know we didn't talk about this before we started recording, but you mentioned that you wanted to talk about the notice of privacy practices because there was a change and, people are fussing about it online. It's nothing. We don't have to do it. We have to do it. I actually had a hygienist friend reached out yesterday and I guess the office manager asked, "Oh, it's not a big deal. We don't have to update anything." But it is a big deal. And do you want to talk just a little bit about why it's a big deal? And then why is there a discussion online that we don't have to do it or that we do have to do it? What is the big stuff that's going on around that, Amy?
Lordy. Okay, so this is where I have to put my nice face on because I get really annoyed at all the we don't have to do this because we're dental and substance use disorder information isn't created by us. So that's really where that complaint is coming from. So there are two things that needed to be updated. Substance use disorder information, whether
Hmm.
you create it, receive it, or collect it, which we do. I mean, if you have patients that are on antidepressants, that's
Yeah,
that could fall under substance use disorder information. It
right.
definitely falls under mental health information. Uh,
Benzodiazepines. Yeah.
right, right. All the benzos. And if you've got patients on Suboxone for addiction,
Hmm.
that counts. That actually plays into dentistry, how you treat them as a patient, whether they need
Absolutely.
to go off that medication or not before any potential treatment.
Right.
So while dentistry is not creating that information, we are receiving that information and it needs to be protected to the same level and standard as we would every other piece of information that we collect about a patient.
Yep. Yep. I had a patient the other day who had disclosed they were a drug addict. Not currently, but in the past.
Once an
So
addict, always an addict.
well, and so I mean, is that not fall in line with
Yep.
that? The substance use? I mean,
And if
so I don't,
you make a note in the chart that they said that to you,
yes.
that
Yeah,
now falls under substance use disorder information.
exactly. So I don't understand what all the
Yeah.
hairy stuff is about it online.
It's, I find it's really interesting. The dental industry seems to be unique in that they will jump on board with being in mainstream medical when
Hmm.
it's advantageous.
Yes.
And, oh, but we still want to be dentistry and we want to be different for
Right.
things that seem like, ugh, this is stupid. I don't want to do this. This
I don't
costs
want
too
to
much.
pay.
Right. And I kind of look at it all as, well, there's a lot of gray area when it comes to this, especially HIPAA and data and security, and it's all intertwined and very
Yeah.
incestuous in a lot of ways.
Sure.
And so I just say, instead of fighting it all the time, just embrace the suck and do it right. So
Yeah.
there's never a question about whether you did it right or not, because your
Right.
patients don't care.
Yeah.
They want it
Right.
done right.
Yeah.
Yeah. Yeah.
Yeah.
So basically, get the notice of privacy practices done, work with, there's one on the ADA website you can get for free for the update like the information for the updates. If you're
Hmm.
intent on doing it DIY, obviously we don't do DIY. When we knew that was coming out and it was due, we just sent out new ones with the updated information, all customized for the client's offices, and it was just done. And they're like, "Oh, you just took care of this? I don't have to do this ourselves?"
And
No.
reminder, you have to have a point of contact, name and everything on your notice of privacy practices. So if you get that document from the ADA website, it still has to be fitted
Updated.
for your practice.
Yeah. I kind of laugh whenever this topic comes up. I just envision what it was like in 2013, and I remember where I was living in Northern California. I would go into these dental offices, and one of the dental offices had gotten a hold of an ophthalmology practice that had done the updates. And
Yep,
that one got sent and resent and resent and resent and reused over and over and over in all these dental practices. And do you think any of them changed any of the information?
absolutely not. They just thought that's what it was.
It had the ophthalmologist's name and contact information and specifics about ophthalmology
Oh my word.
customized
Oh
into
my word.
that template.
Could you
So,
imagine?
well, yeah, I can
Yeah, you
imagine.
can imagine because it did happen.
And the more I see people, especially the social media and the Facebook groups and all of that right now, every other post is, where do I get a free template? And I expect I'll see this again too.
Sure. Sure.
Yeah.
Yep.
I want to go back to talking about the tools because now I'm really intrigued. How long do tools typically, the instruments, how long do they usually last? Because I'm
Well,
not clinical, I don't know.
yeah, well, I mean, so it depends. It depends on if they're being cared for in the right way. For example, let's take dental hygiene instruments. If you're taking care of them and you're sharpening them as you use them so they stay relevant to what you're doing, and they should last a few years. There's not necessarily an expiration date on them. I know with Cavitron inserts, they have the date that they were created or manufactured. That's not an end of life date. You don't have to go off that. But there are different ways of measuring certain pieces of equipment and instruments to make sure that it's still doing what it's supposed to do. So let's take that Cavitron insert one more time. There, it comes with a little card where you can measure the length of that tip because you lose efficacy after you use that for so long. You take your dental scaler or even an Explorer, they become dull over time. And if you're not keeping them sharp, they're not doing their job. Or you can sharpen them so much, you're actually losing material on the end, and then it's not going to be advantageous to use on a patient because it's not adapting to the tooth correctly. Um, if you're not taking care of your equipment, let's say doctor instruments where you may have a hinge on that piece of equipment, they could get rusted over time. They could get really stiff, not easy to use. There are materials out there to help prolong your instruments if you're using them appropriately. Instruments break easily too. I mean, the more they sharpen them, the weaker they can become and they can break even working on a patient. That's happened to me before. So, I mean, to say that they last a couple years, worked in offices where the instruments are clearly over 20 years old. They're not sharpened as well, and so they become really difficult, and you get fatigued using these instruments. I worked in an office this week, Amy, and I opened up a bottom drawer in sterilization because I was looking for something, And I thought, what are all these instruments? They were sterile instruments. They were bagged and sterile, but they had a full gallon size baggie full of instruments. I thought, are these extras? And I'm like, oh yeah, they're just old instruments. We just don't know what to do with them. There's a lot of things that you can do with old instruments, even old equipment. Hugh Freedy has a program called Envirodent where you can donate those sterile used instruments. Either they're broken or you don't need them anymore, they're extra, whatever the case may be. You donate 12 when you get a free instrument back.
That's
So Hugh
cool.
Freedy has a program. Let me look on here too. ProDent USA also has a program where you can donate instruments and get free instruments back as well. You can even donate those instruments. If you're no longer using something, even a piece of equipment. I've been in offices where they've bought new dental units, dental chairs, and who are you going to donate that equipment to? Well, there's all sorts of programs. Look in your local community. There are nonprofit organizations that will take that equipment. I did a mission trip in Honduras after I graduated hygiene school, and all of their equipment was donated. Their autoclaves, their ultrasonic, they had a dental chair that was donated. It was wonderful. They were so excited to receive that. Missions of Mercy may take donated equipment that you're no longer using. If you are going to donate your instruments, double check with that organization. They're going to need those instruments sterilized before you send them that stuff. There's even some nonprofit organizations that will take like even gauze and prophy paste and different types of materials that you're no longer in need of for one reason or another. Sometimes hospitals and medical clinics in the community will take that stuff as well. So there's lots of places that you can donate and share your equipment and instruments to. And it's beneficial. You're helping out your community. There could be members of your family or even your community that are receiving care from these places, and just think you have a big heart donating. But if you want something in return, there are programs where you can send those instruments in to receive new, fresh, clean, state-of-the-art, sharp instruments, which we love as dental hygienists.
Yeah.
So it's kind of a neat program, but there are programs out there. There's an article written in 2024, the top recycling programs for dental instruments, an article in RDH magazine, if anyone's interested. So yeah.
I find it fascinating because every dental office has all kinds of equipment
Mm-hmm.
everywhere. It's not just the clinical equipment. You've got computers everywhere. You've got printers. You've got backup drives. You've got like all this old stuff sitting around.
CDs. Yeah,
Right. What do you do with all of that?
right.
So under HIPAA, we have there's a long, very long and boring document from the National Institute of Standards and Technologies that goes over media disposal.
Mm-hmm.
And there's a couple of approved ways of disposing of hard drives inside computers. So you can donate the computer itself, but you have to pull the hard drive out of it and dispose of that appropriately.
Okay.
And so we used to do this when I had my IT company. We did data destruction day and we did hard
I
drive crushing.
is this where your idea comes from for having like a mad room and just beating up on all this equipment?
The rage room,
The
yeah, but
rage room.
that doesn't make the that doesn't make the hard drives appropriately disposed of.
Okay, gotcha. So tell me more.
Yeah, so there's a couple of approved ways. So hard drives just kind of give you a visualization. They have platters inside them, and then there's a spindle in the center, whether it's a solid state drive or that might be one piece, but either way, these things have to be punched through in a
Mm.
way that destroys it and bends the where the data lives and destroys the hardware itself so that you can't get any recoverable data off of it. Because if you think about it, every admin computer, you're downloading documents from emails, you're downloading x-rays from another practice, you're downloading all these things that end up on your desktop on the actual computer itself. And so you always have some measurable amount of protected health information on those computers. Probably not the operatory computers, but
Mhm.
admin computers definitely. Doctor's computer, all kinds of stuff. Could just be invoices and other stuff they're doing, but there's sensitive information.
Yeah.
So they need to be disposed of properly. Hard drives need to be disposed of properly.
Mhm.
Um, Shredding hard drives was always something I wanted to get into, but it was really messy. And there's a lot of heavy metals in those. So,
Oh, who would
yeah,
have thought?
yeah. But I have seen people that will donate computers to schools or to nonprofits or to people that are wanting secondhand computers because they're expensive and they still have the hard drives and all the information for the practice still loaded on those.
Oh my word. Oh my
So,
word.
yeah, appropriate disposal methods, and I know we want to do the right thing and give to other people, and I honor that. I think that's amazing, but we need to do it the right way. Same with
Yeah.
your tools. I did not know that, so I learned something today too.
I don't know if you heard me say the other day when we were training with our Iowa client that Iowa has this special fact sheet on their regulated waste website about hand sanitizer. So expired
Yes.
expired hand sanitizer, and this must have been a thing that they had to create an entire fact sheet about it. But hand sanitizer, it can be, well, it's a hazardous substance. And it cannot be poured down the drain. It cannot be thrown into the garbage. It's considered regulated waste. So in the state of Iowa, and I'm sure it has goes as far as many other states, but you must follow RCRA, RCRA rules, and the I'm sorry, not the FDA, but the EPA regulations on how to properly dispose of hand sanitizer. So remember during COVID,
Yeah.
everyone was making hand sanitizer, the big gallon jugs from like distilleries were making
Uh-huh.
hand sanitizer with all the alcohol.
They
Well, I see offices
shifted.
that have,
Do
yeah,
you
we
remember
shifted.
they all shifted their buildings and their all the conveyor belts they had with their production and they started making hand sanitizer and I was like,
Yes.
no. Like that's
Yeah.
great and all, but I think
I
people
mean,
need your vodka probably more during
right.
this time.
Right. So speaking of this, if you have expired drugs, expired medications, expired materials, you cannot just throw it down the drain. You cannot throw expired medications down the toilet. It ends up in the public wastewater. I mean, that's from your house, that is from your office, from your place of business. So there are communities, programs, most likely in your area, that will have disposal guidelines.
Mhm.
And specifically, this one Iowa
That's
fact
so
sheet just
weird.
had me going. But there must have been something that happened that caused them to create this fact sheet. And it probably happened after COVID when everyone was trying to get rid of their whiskey-based hand sanitizer. But, if you've got expired medications, expired pharmaceuticals, you can mail them back to the distributor which they came from. Sometimes you can drop them off at your local pharmacy. They have a big disposal box. Of course, if it is a controlled substance, you need to dispose of it according to the DEA rules, to make sure that it becomes not able to be used whenever it's disposed of. So there are certain parameters. If you have any questions, get a hold of us at CPC at Copper Penny Consulting. We'll help you out. We'll send you in the right direction. We'll even look up your, state guidelines for you and help you navigate what to do with this stuff because and possibly this is why dental offices always have a back stock or a back room full of just,
Random.
'cause they don't know what to do with it. Maybe we should start a side business. This is what you do with your stuff if you want to get rid of it and make extra room in your office.
We get so many calls about that.
Yeah.
Just from our own clients. And I feel like we
Sure.
go deeper into things than many others in the
Think some.
industry.
Yeah.
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 And it kind of amazes me that we're still running into more and more and more.
Hmm.
It's also a really great opportunity for us to continue providing advice and education and stay on top of that.
And
but
same, and to help our clients do the right thing because they want to do the right thing. It's
they do.
oftentimes, they just don't know. It's
Yeah.
not that they want to cause harm to the environment or to anybody else. It's they just don't know.
Yeah. I
So,
mean, I remember about a year ago, we had someone asking how to get rid of a nomad.
yes. Yes.
And I didn't know. I'm like,
Hmm.
that's not my wheelhouse, but
Yep.
I
Yep.
bet Deanna knows.
Yes. Radiation equipment is finicky, y'all. Your state health departments have certain regulations on how to get rid of and dispose of X-ray equipment.
Yeah.
So, yeah,
It, it's just so, well, it's amazing for us, but it's annoying for the practices
it is.
that all of these regulations kind of like roll into one another and another and
Hmm.
another, and then it snowballs, and you're like, well, which one was I working on first?
Exactly. Exactly. I know. And there's so many different regulatory agencies that play a role in everything that we do in dentistry. It's not just OSHA, the CDC. I mentioned the EPA and the FDA,
Mhm.
DEA. Everyone, there's so many regulatory agencies. How do you keep up with them? Well, you call us at Copper Penny Consulting and we will walk you through it.
That's what we do. Yeah. That's a good sign off.
Yes, no, this was a great two topics, kind of a little off what we talk about, but yet I think it was really important because this is something that you don't think about because everything's in the back room waiting to get thrown away, and you just don't, if it's out of sight, it's out of mind.
Yeah.
So, but
No,
there's things you can do with that stuff.
there are, and it doesn't just have to take up precious square footage in your office.
Isn't that the truth? Make an extra patient room out of it,
Yeah. Or a break room,
or a break room, an exercise room,
a scream room.
ooh, a meditation room,
Uh-huh. Brain health room.
a nursing or pumping room.
Yes.
Yes. Yes.
Yes. Well, everyone in our organization, we're all done with babies. So,
Yeah, or never got started.
uh, I'm jealous sometimes.
You got a room waiting for you up here. It's Amy's room.
I know. I know. I think I'm going to try to head up for Star of the
Star of
North.
the North.
Yeah. Well, I liked how we started off with two topics and then kind of turned it into the disposal methods that we have to deal with. And
Mhm.
it brings up a really great idea of every office has this problem and we actually solve those problems.
Mhm.
So stay tuned for more information. Keep coming back to watch PHI and PPE with Deanna and Amy. And until next time, stay safe and stay compliant.
Wash your hands.
Thank you for joining us. For more information, please go to www.copperpennyconsulting.com. Bye.